Hello, my name is Viri, and I'm going to be your nursing student for today. And we're going to do a head-to-toe assessment. Is that okay?
Yeah.
Okay, can you give me your name and your date of birth?
Larissa Bedoya, and my birthday is June 8th, the year 2000.
Alrighty, perfect. And I'm just going to verify that with your wristband, and that is correct. I'm going to go ahead and perform hand hygiene for at least 20 seconds, and then we'll start, okay? Alrighty, and I'm going to ask you a couple of questions. Do you know what day it is today?
The 27th,
Alrighty, do you know what season we're in?
winter.
Do you know where you are right now?
Yes, getting my head to toe assessment.
Okay, sounds good. And finally, are you in any pain from the scale from 0 to 10?
I'm at a 0, no pain today.
Okay, awesome. So we're gonna start with the scalp. I'm gonna have you take a seat on the edge of the bed for me.
Okay.
Okay, so I'm gonna go ahead and inspect your scalp. I don't see any lice, any patches of hair missing, any redness, or any bruising. I'm gonna go ahead and palpate your frontal bone and your maxillary, and then your lacrimal gland. Do you feel any pain there?
Mm-mm.
Okay, I'm gonna have you open your temporal mandibular joint. Alrighty, close, and open again. Alrighty, I'm gonna go ahead and I'm gonna take a look at your eyes really quickly. I'm gonna palpate down here, lacrimal duct, and we're gonna start off by assessing your eyes. We're gonna move on to assessing your eyes. I'm gonna have you stand right here for me, and I'm gonna have you read the smallest line you can and cover one eye.
Okay. 9 L E F O P F C T.
Alrighty, the other eye.
9 L E F O D P C T.
Alrighty, and just without your eyes being covered. Sorry.
Okay. Hold on. Sorry. 9 again. L E R O P D F C T.
Alrighty, so it looks like you have the 20/20 vision. I'm gonna have you take a seat, and I'm gonna have you raise your eyebrows for me, puff your cheeks, stick your tongue out, wiggle it back and forth, smile for me, and with your mouth closed. Okay, now we're gonna do a near vision test. Hold this 10 to 14 inches from you and read the smallest line you can for me.
Number 1, in the 2nd century of the Christian era, the Empire of Rome comprehended the fairest part of the earth and the most civilized portion of mankind. The frontiers of that extensive monarchy were guarded by the ancient renown and disciplined valor. The gentle but powerful influence of laws and manners had gradually cemented the union of the provinces. Their peaceful and coveted enjoyed and abused advantage of wealth.
Okay, what line was that?
Number 1.
Alrighty. And that was perfect. Now I'm going to shine a bright light in your eye and just look straight ahead, okay? I'm going to check for pupillary constriction. Alrighty. I'm going to have you look at the tip of my pen and then look back at the wall. Alrighty. Now I'm going to have you follow my pen. So I'm going to do the 6 points, okay? And just follow that. Alrighty, awesome. Now I'm gonna go ahead and I'm gonna have you cover one eye like that. And you're gonna tell me when you can see my finger going into your vision, okay?
No.
Okay, other side. No. Alrighty, awesome. Okay, now I'm gonna go ahead and I'm gonna shine a bright light in your nose. If you could tilt your head back. Okay, everything is intact, mucous membranes, everything looks great. I'm gonna have you cover one nostril. Breathe out. Cover the other one. Breathe out. Okay, and I'm gonna have you close your eyes. And I'm gonna give you something to smell and you're gonna tell me what it smells like, okay?
Lavender.
Alrighty. Now I'm gonna go ahead and inspect your mouth. If you could say ah for me. Okay, yours is intact. Mucous membranes are moist. Okay, I'm gonna test your gag reflex. Okay. Okay, if I could have you smile for me. Gums and teeth look perfect. I don't see any lesions or any teeth missing. Okay, I'm gonna have you close your eyes and I'm gonna give you something to taste, okay? And you tell me what it is or what it tastes like.
Okay. It's sweet.
Alrighty. Okay, I'm gonna go ahead and move on to your ears. I'm gonna go ahead and palpate the auricle, then pull up and back, inspecting the tympanic membrane, and it is intact. Same thing over here, palpating, inspecting tympanic membrane, it is intact. Okay, so we're gonna do a little test with your ears. I'm gonna use this instrument and I'm gonna put it on top of your head. You're gonna tell me if you hear it equal on both sides. Then I'm gonna put it behind your ear. Once you can't hear it, let me know and I'll move it forward, okay? Alrighty. Do you hear equal?
Yes, I do.
Okay. Now we're gonna do the other test. Tell me when you can't hear it anymore. And I'm looking at my watch, making sure the time.
Yeah.
Okay, I'm gonna do the other one on the other ear.
No.
Oh, okay, awesome. Alrighty, now I'm gonna have you stick a finger in your ear and you're gonna wiggle it and I'm gonna whisper some words for you.
Okay. Car.
Other ear.
Toy.
Awesome. Alrighty, I'm gonna go ahead and I'm gonna move down to your neck now. I'm going to go ahead and I'm gonna feel out the lymph nodes. Let me know if you feel any pain, okay? Front of the ear, back. Any pain there? Okay, I'm gonna palpate for the carotid artery. Alrighty, if I could have you swallow for me. Checking if the trachea is midline, and it is. And I'm gonna go ahead and I'm gonna auscultate for any bruise, okay? So if you wanna just hold your breath while I listen, and it won't take too long. Okay. Alrighty, I don't hear any bruise or anything concerning. I'm gonna go ahead and I'm gonna move on to, oh, you know what? Let's do some reflexes. I wanna test that before I move on to your back. I'm gonna have you move your hands up and down, inside over here, then one arm, then the other, then move your head up and down, side to side, and then try to tilt your head kind of like that. Okay, I'm gonna do some resistance, so if you wanna, don't let me push your head to the other side, okay? Okay, other side. Okay, and then don't let me push your head forward. Okay, don't let me push your head back. Okay, and shrug your shoulders for me. Okay, don't let me bring them down. Okay, you can shrug them again. Okay, and if you wanna do this for me, I'm gonna go ahead and try to pull them apart. Don't let me pull them apart. Good job. Alrighty, I'm gonna go ahead and I'm going to have you do some exercises. Rolling your wrist, wiggling your fingers, spreading them apart. Alrighty, if I can have you put your palms up like that, I'm gonna assess for your brachial and radial pulse and everything. Yep, perfect. I'm gonna assess for your epitrochlear node. Any pain there? Okay. Alright, now I'm gonna go ahead and move on to the back. Okay, I'm gonna inspect your back. I'm looking at the texture. looking at your skin, I'm looking at your breathing. It doesn't seem like you're having any trouble breathing. Everything looks great. I'm gonna go ahead and I'm just going to palpate your spine and your scapula, okay? So you're just gonna feel some kind of pressure. Any pain there? Nope. Okay, I'm gonna do your spine. I'm gonna palpate it. Any pain there?
No.
Okay. I'm gonna go ahead and I'm gonna percuss for the costovertebral angle. Any pain?
Nope.
Any pain?
No.
Okay. I'm gonna go ahead and I'm gonna percuss your spine, okay? Okay, I'm gonna have you take a deep breath in, checking for thoracic expansion and out. Alrighty, now I'm gonna have you say 99 when I put my hands on your back, okay?
Okay. 99, 99, 99, 99.
Perfect. Okay, I'm gonna go ahead and I'm gonna percuss the noises of the heart, the lung sounds, just for resonance, so you can feel some taps. Okay. Now I'm gonna take a listen. If you want to take a deep breath every time you feel my stethoscope,
Okay.
and then let me know if at any moment you feel any pain, okay?
Okay.
Alrighty, perfect. Now I'm gonna have you raise one of your arms and hold it against the back of your head. And I'm gonna listen to your heart sounds at the front, okay? I mean your heart sounds, your lung sounds on the side. Take a deep breath. Alrighty, other side. Alrighty, awesome. Now we're gonna move up to the front, and I'm gonna go ahead and I'm gonna listen to your lung sounds and heart sounds, okay? Okay, take a deep breath. Alrighty, awesome. I'm gonna go ahead and I'm gonna listen to your heart sounds, okay? Then the maximal impulse of the PMI, listen to for a full minute. And then the epigastric. Alrighty, that seems great. It sounds great. I'm gonna have you lay back down, okay? Alrighty, my patient is at a 45-degree angle, and I'm gonna check for venous jugular distension. I'm gonna have you look that way towards the window. I don't see any venous jugular distension. This way. Awesome. Okay, I'm gonna go ahead and I'm gonna lay you flat and I'm gonna listen to your heart again just to make sure I didn't miss any, to assess for murmurs. and turn to your left side. Alright. I'm gonna listen one more time to your heart. Listen to the PMI for a full minute. Then the epigastric. Alrighty, everything seems fine. I'm gonna have you lay back down, and we're gonna start with an abdominal assessment. And I'm just gonna go to the other side. My tools over there. Alrighty, and I'm inspecting the abdomen. Skin is intact. No hernias that are noticeable. And first, I'm gonna go ahead and I'm gonna take a listen. Okay. Alrighty. Oh, and I'm also gonna auscultate for any bruise as well. I'm gonna go back to your epi right in the center over here. Okay, I don't hear any bruise. Alrighty, I'm gonna go ahead and I am going to percuss those 4 quadrants. Is that okay with you?
Mm-hmm.
Okay. Any pain there?
Mm-hmm.
Okay, I'm gonna palpate lightly. Any pain there?
Mm-hmm.
Any pain here?
Mm-hmm.
Okay, now I'm gonna test for your abdominal reflexes. So I'm just gonna go ahead and draw some lines across your stomach, okay? I know it tickles. Alrighty, now I'll just have you kind of do a little bit of a sit up, but try to stay laying down. So kind of just, yeah, just like that. And your abdomen is contracting. Awesome. You can go ahead and pull your shirt down. Now I'm gonna assess your legs. I'm gonna pull these socks down a little bit. Alrighty, I'm assessing for temperature. Temperature is normal. I'm also assessing for edema. No problem with that. Okay. Now I'm gonna assess your pulses. So I'm gonna check your popliteal. Then I'm gonna check your Achilles one. And then your pedal. Alrighty. I'm also going to at the same time assess your pedal reflex. So you're just gonna feel like my instrument kind of twists around your foot, okay? It might tickle. Alrighty, and that seems normal. Now we're gonna do some range of motion with your legs. Lift your right leg up, then the other one. Then try to put your knees to your chest, each one. Okay.
Sorry.
No, you're fine. Alrighty, now bring your leg out, and then now this one. Alrighty, now we're gonna do some range of motion with your toes. Wiggle your toes. Yep, circular motion. Alrighty, and now just simulate like if you're driving a car, like a gas pedal, push down, up, then move your toes to the side and then the center. Wiggle your toes. Can you do some circles with your feet? Your ankles. Alrighty. Okay, I'm gonna need you to close your eyes, and you're going to tell me if your feet are pointing up or down. Okay?
Up, down, up, down.
Okay. I'm gonna test for resistance. Now that your legs are together, don't let me pull this leg out. Okay? Put your leg out. Don't let me push your leg in. Okay? Other side. Same thing. Don't let me push your leg out. Okay? So bring your leg out. Don't let me push it in. Alrighty. Awesome. Okay. I'm gonna go ahead and I'm gonna have you take a seat on the edge of the bed one more time again, and we're gonna assess for your reflexes, okay? Alrighty, so I'm gonna use this tool to assess for your reflex. And I'm gonna have you put your arm like that. And I'm just gonna go ahead and I'm gonna assess that reflex. Okay, and I see that reflex. No, yeah, position your hand right there. Okay, I see the reflex. Same thing with over here. Okay, now I'm going to assess your patellar. Okay, your Achilles, back of your leg. Alrighty, and I'm gonna assess that pedal response. Okay, awesome. We are done with that. Alrighty, now I'm gonna have you stand up and take a couple of steps towards the wall. And I'm assessing your gait. I'm noticing you're walking normal. Now walk heel to toe towards me, and I'll tell you when to stop. And you can stop right there. Alrighty, now I'm gonna have you bend forward to check your spine. And her spine is normal. I don't see any signs of scoliosis. I'm gonna have you bend back and kind of try to like tilt your back side to side as well. I'm assessing that, and you're doing great. And you can go ahead and have a seat. Okay, now we're gonna do a series of neurological tests. So I'm gonna put this cotton swab and I'm gonna test where you feel it. You tell me where you feel it, okay?
My forehead, my nose, my chin, my cheek, my neck, my arm, my left arm, my knee, my right knee, my right foot.
Okay, awesome. Alrighty, now I'm going to assess you for a sharp or soft, and you're gonna tell me if you feel sharp or soft, okay? Hold on, let me get my tool out. Okay, this is, let me pull your palms out. This is soft, this is sharp, okay? Okay, you close your eyes for me.
Sure. 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 Sure.
Okay, good job. I'm gonna give you something on your hand, and you tell me what it is, okay?
Keys.
Okay, good job. And now we're gonna assess for 2 points and 1 point. So this is 2 points, this is 1 point. And if you could go ahead and close your eyes, you tell me what you feel. Hold your palms out for me. I'm gonna do it on random response.
Do it in. 1, 2, okay. 1, 2, 2, 1.
Good job. Okay, now I'm gonna assess for your vibratory function. So I'm gonna put this on the bony areas of your body. You tell me if you can feel it and where, okay? Close your eyes.
On my toe, on my knee, on my ear, on my shoulder, and on my head.
Okay, good job. Alrighty, now I'm gonna have you close your eyes one more time. We're almost done. And I'm gonna draw some shapes and numbers, and you're gonna tell me what they are in your palm, okay?
Do it again. A 1 or a 7?
It's a letter. I'll try a different letter.
Okay, okay. A T. It was a T.
Okay. This is a number?
I'll do it again. Sorry.
I'll do an easier number.
1.
Okay, good job. Alrighty. And I just want to make sure that I covered your taste and smell. So I'll give you one more thing to taste. Close your eyes for me. What does it taste like?
Sweet.
Okay. And keep your eyes closed. And tell me what this smells like.
Lavender.
Okay. Awesome. Alrighty. So we have concluded our head to toe. You can lay back now.
Thank you.
And get all comfy in bed. Alrighty. And I'm just gonna go ahead and I'm gonna hand you your call light. You tell me if you need anything.
Okay.
Any questions?
No.
Okay. Well, I'm gonna go ahead and perform hand hygiene and I'm gonna document. And just press the call light if you need anything, okay? Thank you for your time.